There's a couple different things that we can be looking at when it comes to preparing for labor. One, I like to look a lot about like labor positioning and making sure that we have good hip mobility to be able to access those positions. So typically in labor, you think that like you've got your knees up towards your chest and your knees are super wide. And what that does is it's great for opening up. So this is the pelvis here and what we call the pelvic inlet. So when our knees are wide and up towards our chest, the pelvic inlet is increasing, which is really great for like an early labor type of situation. But if we're thinking about trying to push the baby out, we actually need to open up the sit bones and get the tailbone out of the way. So one of the things we talk a lot about as far as labor positioning goes is getting on maybe like your hands and knees or laying on your side so that your tailbone has more mobility. This is the most mobile part of your pelvis. And so if we're laying on our back, we're not going to be able to have that tailbone mobility. So getting into a position of comfort that maybe has the tailbone out of the way can be really beneficial. And then also, in order to get the sit bones to widen, we need to actually turn our knees inward. So what we call hip internal rotation. And so I like to give some stretches to make it easier to access that position. Things like sitting on the floor with one knee out and one knee in, or certain lunging positions can help with improving that hip mobility. Other things are looking at your breathing strategies. So one thing that a lot of people think is that your pelvic floor is what's helping push the baby out. And actually, it's what's getting out of the way. It has to get out of the way. So some of these muscles have to stretch 3 to 4 times their resting length. So if you can imagine your bicep being 3 to 4 times its resting length, that's how much your pelvic floor needs to stretch. So we don't need it to help push it out, we just need to help it get out of the way. What we do for that is with some breathing strategies, if we can focus on a really big inhale and allow the belly to get really big, that can help the pelvic floor drop. And then when we exhale, we do a really slow and out your mouth sigh. So having that low sigh can help maintain the pelvic floor relaxation versus doing like a shouting or a shrieking. Some people will like to really like shout when they're exhaling, and that can cause the pelvic floor to contract, or even doing like high-pitched sounds can make the pelvic floor contract more. And we certainly don't want to be like bearing down to push down if we can help it, because that can cause the pelvic floor to contract, which is a little counterintuitive considering how much we want it to stretch. So in recap, as far as preparing for labor, if we can be mindful about our positioning and maybe do some hip stretches, if we can be mindful about our breathing and then try to avoid bearing down, that is going to be really helpful for your labor prep. And if you want to learn more, we do labor prep classes every quarter. So you'll be able to sign up for those classes and get to learn more about how to best prepare for your labor.